Median nerve is also called as labrador's nerve. Origin is by two roots. Medial root comes from the medial cord. Root value is C8, T1. Lateral root comes from the lateral cord. Root value is C5, C6, C7. Total root value is C5, C6, C7, C8 and T1. So in the course and relations, the key points are descends along lateral side of third part of axillary artery and proximal part of brachial artery. So in the middle of the arm, crosses to medial side in front of brachial artery. Descends along medial side of brachial artery. So you can see here, you can see, so this is the median nerve which is formed along the lateral side of the axillary artery. Then it descends along the lateral side of the brachial artery. So in the middle of the arm, the median nerve is crossing in front of the brachial artery to the medial side. Then it descends vertically downwards along the medial side of the brachial artery. So it is the medial most content in the cubital fossa. Then it leaves between the two heads of pronator teres. You can see this is the deep head, this is the humeral head, and this is the ulnar head, otherwise the deep head. And you can see here the ulnar head separates the ulnar artery from the median nerve. Then you can also see the median nerve is passing through the opening in flexor digitorum superficialis. Then in the forearm it will be plastered to the posterior surface of flexor digitorum superficialis. Then around 5 centimeters above the wrist or flexor retinaculum, it emerges from lateral border of flexor digitorum superficialis. Then it passes deep to the flexor retinaculum. Then after crossing flexor retinaculum, it terminates into two terminal branches, one lateral terminal branch and one medial terminal branch. So the lateral terminal branch will give recurrent branch which supplies the thenar muscles, which is a muscular branch, and finally it divides into three proper palmar distal nerves. The medial terminal branch will divide into two common palmar distal nerves, supplying the second and third web space and adjacent sides of the. This is the index finger, this is the middle finger, and this is the ring finger. So in the cubital fossa, the median nerve rests on brachialis and lies beneath bicipital aponeurosis. Then it leaves cubital fossa between superficial and deep heads of pronator teres. So here ulnar artery is separated from median nerve by deep head of pronator teres, as I have shown earlier in the diagram. So here, so this is the ulnar artery which is separated from median nerve. So it is separated by pronator teres. So then enters forearm below tendinous arch of flexor digitorum superficialis. So descends between flexor digitorum superficialis and flexor digitorum profundus. It is closely applied to posterior surface of flexor digitorum superficialis, accompanied by arteria nervi mediana, which is a branch from anterior interosseous artery. So you can see here, so this is the median nerve in forearm. And you can see here 5 centimeters above flexor retinaculum, emerges along lateral border of flexor digitorum superficialis, lies between flexor carpi radialis and palmaris longus, then passes through carpal tunnel. Beyond distal border, it terminates by dividing into medial and lateral branches. So here you can see this beyond the distal border of flexor retinaculum, it is dividing into medial, this is the medial and this is the lateral terminal branch. So what is the fate of the medial terminal branch? The medial terminal branch will divide into two common palmar distal nerves. So they are named as medial common palmar distal nerve and lateral common palmar distal nerve. So lateral common palmar distal nerve will give a branch to second lumbrical and adjacent sides of index and middle fingers. Median common palmar distal nerve gives branches to adjacent sides of middle and ring fingers, receives a communicating branch from nearest palmar distal branch of the superficial branch of ulnar nerve. So termination, lateral terminal branch. So recurrent muscular branch. So this is the most important branch which is supplying the three thenar muscles. So three proper palmar distal nerves or one proper and one common. So supplies both sides of thumb and radial side of index finger. Total lateral 3.5 digits supplied by the median nerve. So you can see here. So this is the recurrent muscular branch. Then you can see here. Either we can consider these are the three proper palmar distal nerves, which is the most common, or there might be one common and one proper palmar distal nerves. So branches, muscular, cutaneous, articular and vascular. So muscular branches, in the arm there will be a branch to pronator teres just above the elbow. So in the forearm, the main trunk of median nerve will give branches to pronator teres, flexor carpi radialis, palmaris longus, flexor digitorum superficialis. Whereas through anterior interosseous nerve, it supplies flexor pollicis longus, pronator quadratus and flexor digitorum profundus lateral half. So in the palm, it supplies three thenar muscles, first and second lumbricals. Occasionally, it might give a tick to third lumbrical also. So then cutaneous, palmar cutaneous branch rises above flexor retinaculum, supplies central part of the palm and lateral 3.5 digits. So you can see this is the cutaneous distribution of median nerve on the palmar aspect, and here you can see this is the cutaneous distribution of medial nerve on the dorsal aspect. So this corresponding part of the lateral 3.5 digits on the dorsal aspect will be supplied by the superficial branch of the radial nerve. Articular branches, it gives articular branches to elbow, wrist, superior and inferior radial nerve joints. Vascular branches to the axillary artery and brachial artery. So you can see here, you can see this is the median nerve which is in close approximation with the axillary artery and the brachial artery. So it is giving vascular branches to it. So then what happens to the injury if there is an injury to the median nerve at elbow? So these are the following clinical features which you can observe. Forearm is supinated definitely because pronator teres and pronator quadratus which are supplied by the median nerve are paralyzed because median nerve is injured. Then there will be weak flexion at the wrist definitely because the flexor muscles are paralyzed. Then adduction at wrist because flexor carpi radialis is paralyzed, which is supplied by the median nerve, whereas flexor carpi ulnaris, which is supplied by the ulnar nerve, is still intact. So there will be adduction at wrist. There will be no flexion at interphalangeal joints of index and middle fingers. There will be no flexion at interphalangeal joints of index and middle fingers because both flexor distans profundus and flexor distans superficialis tendons going to these two fingers are paralyzed. So thumb is laterally rotated and adducted, resulting in ape thumb deformity because abductor pollicis brevis muscle is paralyzed. So cutaneous sensation lost on lateral 3.5 digits. Injury to median nerve at middle of the forearm leads to pointing index. Flexor distans superficialis to index finger gets affected. So this is the benediction deformity, this is the ape thumb deformity, and this is the pointing index. So you can see this is the benediction deformity, whereas this is the claw hand. See the major difference. So here the defect is inability to flex at the metacarpophalangeal and interphalangeal joints of middle and index finger, and this is due to damage to median nerve. Whereas here you can see in the claw hand, here the inability to extend fingers at interphalangeal joints, resulting in permanent flexion. So there is a difference. So this is a benediction deformity which comes due to median nerve injury. This is claw hand which comes due to ulnar nerve injury. So this deformity occurs when the person is trying to make a fist, whereas this deformity occurs when the person is trying to extend the fingers. So this is the ulnar claw, this is the hand of benediction. You can see the lesion of ulnar nerve. Here it is the lesion of median nerve. So it appears in long-standing cases, whereas benediction deformity appears when patient attempts to make a fist. So digits affected are little and ring finger. Here the digits affected are middle and index finger. So muscles paralyzed are two lumbricals, medial two lumbricals, whereas in case of this there are lateral two lumbricals, lateral half of the FDP. And here you can see the movements involved: unopposed extension at metacarpophalangeal joints and unopposed flexion at the interphalangeal joints. Whereas if you see in the hand of benediction, inability to flex at the metacarpophalangeal joint and interphalangeal joints of the middle and index fingers. So there is voluntary flexion at metacarpophalangeal and interphalangeal joints of the ring and little fingers because flexor digitorum profundus supplying these two fingers is spared because it is supplied by the ulnar nerve. So carpal tunnel syndrome, compression of median nerve in carpal tunnel. So it results in weakness and wasting of thenar muscles, loss of opposition, then loss of cutaneous sensation of palmar surface involving lateral 3.5 digits. So you can see in carpal tunnel syndrome, so on stimulation of the median nerve, there will be pins and needles in the area of distribution of the median nerve. So this is the positive tunnel sign. Then you can see this is the phalanx test where if you just approximate both the dorsums of the hand with flexion at the wrist, you can see there will be stimulation of median nerve which results in aggravation of symptoms of carpal tunnel syndrome.